Hey guys, so it's Diaria here. I wanted to talk about methotrexate today. For those of you guys who are new to rheumatology and are being prescribed methotrexate, it's very common. So I wanted to go over that so you have a better understanding of it because some of it is a tad confusing. Okay. So methotrexate in the rheumatoid arthritis realm is what's called a DMARD. D, M is in Mary, ARD. And that's the short term for disease modifying anti rheum. Okay. I'll just, you know what? I'll put it up in the description. We call them DMARDs for short. Okay. And so, like I said before, this treats rheumatoid arthritis. It actually treats a bunch of other things too. It treats lupus, Crohn's. It also treats various other autoimmune things, but we're going to focus on the RA of it all because that's what I have. And so it comes in a few different forms. Most people are started out with the pills. So I have those because I take methotrexate right now. So I'm going to show you real quick. They can be different colors. So oh gosh. So mine are yellow. I've seen some that are orange, but you see how tiny they are? This is one dose. You usually take it once a week, unless your doctor does something different. And so each one of these itty bitty pills is a 2.5 milligram tablet. And when you look at the bottle, it's going to, I'm sorry, this is backwards. It's going to you see the 2.5, I know it's backwards, but it's a 2.5 milligram tablet, but then the instructions will be take however many you're prescribed once a week. Okay, so that's the pill option. For people or kiddos who cannot take it, because yes, even with juvenile arthritis, their kiddos as young as 12 months I've seen, obviously they won't be able to swallow pills. Another option would be to give it via shot. So this is a vial, because I tried methotrexate for okay, it's kind of blurry. It's kind of blurry, sorry. But this is a vial of methotrexate. This is a very old vial, so that's why it looks yellow. This is old. I just keep it for demonstration purposes. And so with that, it would also be once a week, but instead you would draw it up in a vial like this and give it as a shot, similar to how people with diabetes give themselves insulin shots. You give it the same way, except instead of insulin, it's methotrexate. Another option that isn't as common is the pen. And so the name of that one, the brand name is Rasuvo, I believe. That one is not as easy to get insurance to approve because insurance prefers you to use the generic. That said, if you are having issues and you don't tolerate the pills, or you struggle to give yourself the shot, or it's a little kiddo and it's oh no, they automatically see the needle and it's no, there is a pen version. That one takes longer to approve with insurance versus typically, from my experience with insurance, at least in the US, they will approve methotrexate fairly easily for rheumatoid arthritis because it's been around for so long and there's so much research out on it. So how long it takes to work, it's different for everybody. So for me, I started on the pills. And when I was taking the pills once a week, I ended up seeing or noticing a change within the first few weeks. It doesn't fully work that quickly. It can take upwards of, a few months. Some people, it even takes up to 6 months. I believe many insurance companies, from my personal experience and my work experience, they usually want you to try it for at least 90 days. So that's about 3 months. But technically, with some of these meds, they could take up to 6 months to start working, which is a pain. So common side effects with the methotrexate, we'll start with the pills. Upset stomach, nausea, vomiting. That is the main reason that a lot of people, from what I have seen, have had issues tolerating the pills is if it upsets their stomach. Now, to circumvent this, you can take it with food. Some people, their stomachs are so sensitive that even taking it with food is not cutting it. Or like I said, if it's a little kiddo or someone who like has issues swallowing pills, that's not obviously going to work. And then for the shot, it mainly is, from giving yourself a shot, you might have like a little bit of redness around like the place where you actually poked yourself or someone poked you, might have a little bit of irritation there. Another side effect too, I have not experienced, my stomach tolerates methotrexate well, is also for some people, if their like skin and hair system is sensitive to methotrexate, then their hair could start to thin or come out. And like I said, if any of these things happen, talk to your doctor. You do not have to be stuck with the medication and if it's causing those unwanted effects. You know what I'm saying? So I just wanted to throw that out there. So the special considerations with methotrexate, it is a teratogenic med. So that's the fancy word for you do not ever take this if you are pregnant, possibly pregnant, or breastfeeding. It is a huge no. Okay. Technically, while this isn't the same dose that cancer patients get, because they get a much higher dose, they get it, in a much deeper way, they don't just, from my knowledge, they don't just take the pills and that's it. We take a much lower dose. But that said, it does have chemotherapy type effects. So it can cause problems and birth defects. And actually, if I remember correctly, methotrexate is a medication that is used, that can be used for abortion purposes. So if there's any chance that you want a child during the time you're on this treatment, or you might be pregnant or you're breastfeeding, this is a big no. You have to tell your doctor that. Best practice from what I've seen is if you are a female and you are having periods, you're on methotrexate, a lot of doctors I've seen will highly recommend you're on some semblance of birth control. Okay, so that way, things happen, if it happens accidentally, then at the very least you can be like, oh, and, stop things in time, so that's one thing. Another thing, like I said, with the concern, because it does treat cancer, so it is technically considered chemotherapy. As far as its drug class goes, with rheumatology and like autoimmune conditions, we are not taking nearly the same dose that cancer patients are taking. And the way we're taking it is different versus, cancer patients, it goes in through an infusion at a much higher dose, it is going deep into the bloodstream, like directly in there. You know what I'm saying? We're not doing as high of a dose, and we're not getting it as potent of a dose. The main purpose of methotrexate is basically, like most rheum meds, to calm down the immune system, because it's overactive. It's overactive in a different way that cancers is overactive. So there are very different ways that like your immune system can be overactive, and it just calms it down so it's not like trying to attack other tissues. So with that said, I hope this video was helpful. I've been seeing and getting a lot of questions about starting methotrexate, and it is a very nerve-wracking process. I highly recommend, what helped me was to just talk to my rheumatologist. Any question you have, no question is too stupid. Ask, because you need to know what you're getting yourself into when you start the medication. And if it doesn't work and you're sensitive to it, that's okay too. Or if you're not comfortable taking it, that's okay too. You have good reason. So keep good communication with your doctor. And with that, I will see you guys in the next video. Bye.